Hi there, my name is Bambi Mathay and I'm a massage therapist, an oncology massage therapist at the Dana-Farber Cancer Institute Zakim Center. And I am doing this at the request of my friend and colleague, Diana Dapkins, and was hoping to just share some ideas with you on how we can still continue to serve our patients or our clients during this time when we can't do any hands-on. As you can see here, my massage table has been converted into a virtual desk, and I will simply flip over, pardon the small room modification here for my virtual screen in the back. I just hang a blanket there so that it's a little bit more of a pleasant background for my patients to look at when I'm doing Zoom with them. So we figured as a team, my colleagues over at Zakim, Teresa Oshankowski and Erica Slocum, that our patients, and I'm sure your clients, see you for a reason. They trust you. You've created a therapeutic relationship with them. And, you know, if they were going to see somebody, they would much rather see you than anybody else, or they would listen to things that you might be able to share with them versus going to somebody else. So what we did was we created a list of techniques that we could use as a full self-care module that we teach our patients via Zoom. So we either demonstrate it to them and they demo back, or we do it together. A lot of my patients actually choose that we do it together, and they can just follow what I'm doing on my body. And it's cool because we are kind of still interacting together, even though we're doing this virtually. For the situation in the oncology practice, we also have a set of symptoms that are most commonly manifested by our patients. So, like anxiety, pain, fatigue, GI symptoms, neuropathy, and insomnia. So, we try to talk to our patients just like we're talking to them when we're checking in, and finding out which one of the symptoms they would like to work on. And then we draw from the template that we created of techniques, and we combine certain techniques to address that particular symptom. For those of you that might have other tools, like some of you may be yoga instructors, you can add some stretching. Some of you might be acupressure practitioners, like I do have some basic acupressure training as well as energy medicine training. So I use my model here to show patients the points that might be helpful for their symptoms, and or I show them on their body, again, demonstrating or doing things with them. Other tools that are common are people that may be lymphatic drainage therapists. Both Teresa and I are also trained in manual lymphatic drainage. So we are able to help our patients review the techniques of lymphatic massage, but also the direction that best supports their current situation for some of our patients that have lymphedema. Now, if you're a Reiki practitioner, as you already know, you can do Reiki long distance, and you don't even need Zoom for that. You can just set aside a date and a time with your patient and decide for whatever length of time you're going to do the Reiki treatment, and you can have your healing space together during that time. What I've been doing, because my patients do like to connect via Zoom, and I like to see them too and check in on how they're doing, is that we leave the Zoom application open I tell them that, we're going to be starting the session. Some of them choose to hear my voice as I'm moving my hands through the body, or some of them want quiet. So I just adjust to whatever they need, just like I would if I'm in my regular session. Some teachers have used a surrogate body, or like a stuffed toy, teddy bears, or you can also use this model and pretending that this is your patient or your client. You can put your hands on here so that your visualization or your intention is more focused, if that's what you feel you might want to do. So as far as techniques, that's what's in my toolbox. But another idea is to have different tools that you might recommend for your patients for self-care. So these are two tennis balls and a sock. And again, for our oncology patients, we have to talk to them about precautions and pressure and where not to put the points for this. Tapping tools are another good thing to have. It's waking up the muscle. Again, for our patients, we're always trying to consider what's going on with them and where they are in their treatment so we can make the proper adjustments. So different kinds of balls for the feet, tennis balls, or these kinds of balls for people that have neuropathy, where it might actually help having a different sensory perception. And I'm sure you guys have your own toolboxes and toolkits for your patients and what you can share. So I think that's all the ideas that I currently have right now. If you have websites, which I'm sure you do have, you can put your slides of techniques that you might want to share, or different short videos or pictures of the things that you might want to share with your patients, because obviously more than ever people need us now, and even though we can't be there personally, we can still be of service, as I said. But don't forget, first things first, take care of yourself as well, and be well and stay well. Thank you.